leg height discrepancies? Is the knee not functioning totally normally? Like you say, it feels like it's hyperextending. So that would also make you, you know, look like you have a limp, but not to the degree that you have now. Most of that's just the weak hip.
Yeah, I was thinking like a brace to some extent would probably help if I was able to wear a brace on my knee just to make sure I'm stable and I don't hyperextend, and then I can be more confident in that step. But that would be something more along the lines of if I had the implant, because obviously I can't wear a brace and the socket. It's one.
Yeah. So
Um,
that's interesting. That I don't think you can hyperextend, but I mean it's not impossible
well,
over
like
time.
it's
It might
really
feel like it.
painful when it like gets to that lockout position. Like it's a
Gotcha.
really bad pain.
Oh, okay, so that's not good.
Like
We
if
don't
I
want
get
that.
to there, and it's happened a
Right.
couple times. Like I'm formerly a mechanic. Like I worked at Berlin City Kia for
Right.
like I have
So
I've
gotcha.
changed I've totally changed gears with like what I'm doing, but it's still a passion. I went to try to work on some stuff, and for instance, I
Yeah.
stepped on a rock on the pavement, and I think it hit like the middle of my foot, and I teeter tottered in on it in a way where it locked out the hyperextension, and it
Uh-huh.
really hurt. Or I walk on
Yeah.
a lumpy frozen yard, and it hyperextends that way, and then I'm like really struggling to keep it in line because of that new like
Right.
length there. I feel
A
like I
little bit
have to
new, right, range of motion. Okay.
land
Well,
bent. And that goes into my other question is like obviously I have like the knee like this kind of support around the prosthetic. So then
hmm
if I were to be like osteo integrated, do you think a
hmm
lot of my like support kind of comes from these like wings and my ability to be in the socket around the knee, or like do you think my knee is like plenty
I
good
think your
enough
knee's
to
pretty stable.
walk with an implant?
Overall, your knee's pretty stable. So I don't think that you would, I don't think you'd miss that support if you did osseointegration.
Okay, because that's still the goal.
But it is a very good question. And I mean, I need to have your knee examined by probably by Dr. Holworth just to confirm that you don't rely on that socket design for knee stability, that you would be missing it if he osseointegrated you.
Yeah, because
Because I mean, it's a very good
it's
point.
a big concern.
Uh, yeah, no, I get it. I don't think that you rely on that because I don't think it gives you that much support. Although it might feel like it, like the reality is if your knee was gonna
There's no way for me
fly,
to
it would
really tell,
fly. Right,
with
of course.
while wearing the socket. I mean, when I
Sure.
was young, I used to run around without the socket, just on my stub, like,
Yeah,
and yeah, I don't know. That didn't like
that's yeah.
it
When
didn't give
when we're
out
young,
then.
that works. As you get older, it doesn't work anymore. It becomes a problem. Let's take a look here.
I was just
So
thinking
you
about it
did
in the terms of like my knee was stable then enough then to just
right. It's a good point.
to just be able to like do that, without like
It's a good point.
the bracing of
So
the socket.
right. That's I mean, when I examined your knee, I thought you had a lot of stability. And in
Yeah,
fact, I thought it was more of an issue if you were a little bit tight,
right.
as opposed to unstable. That's why I think that you'd be okay with OI. And I think that your pain's getting a lot better too, which is we were a little concerned, that if your pain continued and was severe, that even the OI might not help that much. And
I mean, I know we never confirmed an actual diagnosis, like my PT didn't, you didn't, nobody, but I do think it was sort of a tendonitis and is still sort of a tendonitis type issue that obviously I'm just gonna keep
you're
working
you're
through,
rehabbing your way through it, which is great.
and it will slowly disappear out of the picture, I hope, but
I think so. We think so, and you're kind of proving that that's true. That's really good feedback today.
I'm still just immediately gonna like with the time of the year that we're going into, I'm about to start having terrible overheating issues that limit me very much. That's why it's a big thing with the osteo still.
Okay.
Yeah.
Well, I want you to get rid of the limp,
I,
meaning
I
we're going to give you a new PT prescription. They'll give you some exercises to do. And I think within 1 or 2 months, that limp will be like significantly less and it should be gone at some point. Granted, there are other inputs that maybe we can't fix, but unless we revamp your whole prosthesis. Um, the prosthesis also can be done in a way that where you don't tend to hyperextend, right? So like the way the foot's attached, the angle it's attached at, they can offset things a little bit so that you have slight flexion. I mean, there's tricks they can do to make you not hyperextend.
I'm going this coming Monday to mess with the socket,
Good.
so
Okay.
maybe you can
Excellent.
make
That's
some
soon.
adjustments.
Yeah, just explain to him you're hyperextending and it's you hate it. And that causes you a lot of pain. Meanwhile, again, like I need to get you to when's your next PT appointment?
My PT texted me and they have a cancellation at 4 today, so I'm going in at 4. But
All right, so we'll give you this
typically,
prescription right now. Just bring it with you.
yeah,
Okay?
okay,
Bring it with you because I want them to start on that hip right away and give you a home program
okay.
because that you're going to see huge improvements in the way you walk pretty quickly.
I was thinking in the meantime, till I'm like just going off what you said, um, how I can like rehab out of that limp, but like in the meantime, if I can put a little like uh like shim or something either in my shoe or my prosthetic just to kind of help. I know it'll make my hips uneven at that point, and it's obviously not going to make my knees even, but I won't limp as like I won't feel like I'm falling over as much. Therefore,
Mhm.
it'll make the like my walking maybe a little bit better. And then maybe I can
Right,
be a little bit more confident with my steps, and then more
right,
muscles will activate, and
right. Fair enough. Yeah, can you have the prosthetist just do a quick like leg length assessment based on with you standing in your leg and figure out how much lift you need?
yeah, I mean it would probably be the
Otherwise, you're kind of guessing.
discrepancy between my knees, right? Like that much.
Um, well, it also takes into account the length of the prosthetic, right? Like whatever length he set it at is a big deal.
Mm, yeah, that's true.
So we don't know. I don't know what length he set it at. So just like if we, if you wore a shoe lift to even your knee heights, right? And he had already compensated for some of that in the length of the prosthetic, then it'd be too long and you'd feel weird.
Yeah, I don't think there's any compensation in the current setup. It's just exactly how it was when I was like standing
Right.
straight.
He should be able to measure you though. Like just stand up, you're standing up with the leg on and look at your pelvis and see if it's level or not. You should be able to get a pretty good sense of that. And then tell you how much lift you'd put in the shoe.
Yeah.
Okay.
Um, so how was the X-rays looking? How does the what's the
So
bone looking like
x-rays,
on
I just pulled up your x-rays. They're 323, right?
yeah.
Good. Okay. So I'll pull them up and share them with you. Okay. Let's look here. Oh, that's stupid screen. Hold on a second. All right. Doesn't make any sense. I mean, what the hell happened to your x-rays? They were right here. Hold on.
Is my when we go to take the hardware out, is that
Yeah.
gonna cause me to have like more like how when we took the screws out, obviously I had new pain and a new thing to rehab through. But when we take the rest of the hardware, I was just gonna come right out my hip and I won't have as much issues because obviously it's my hip, not my knee, where there's
Right.
more motion.
Yeah.
So, what does that like look like typically?
So, I mean, here's the hardware, right?
Mm,
And that's healed really well now. I mean, your lengthening site healed really well. At the end of the day, that's beautiful. That's as good as I've ever seen. So that's awesome. The screws are out of the bottom part,
right.
and you still have the screws in the top part. So that's that. Um, and then this, when the rod comes out, it goes back through your muscle again, but it doesn't seem to cause the same limping. I'm not sure why. We're making an incision in the muscle, pulling it out. You don't get the same limping again. So we want to rehab that a little bit prior to doing any surgery.
That's what I was
Um,
wondering. Does like it's not gonna like cause like reverse effects of like me rehabbing it beforehand?
yeah, strangely, it really, I mean, it's not, I don't know what causes the limp, right? Because we make an incision, we push through the muscle, we put the rod in, and then people they get weakness, they get a limp, and then they rehab and it goes away and they're fine. Then we go do the same incision, pull the nail out, and nobody limps. So it's something about the osteotomy itself, in addition to going through the muscles in the area that kind of makes them shut down. But when we pull the rod out, even though we're making an incision through the muscle again, the muscles work fine. It's about 2 weeks, then you're walking normally again. So it's a 2 week recovery. But during the 2 weeks, you're walking immediately. It's just maybe not perfect for about 2 weeks, and then it goes back to being a good
Yeah,
walk.
just pretty sore and weak, right?
Yep. It's just sore, right, for the first few days mainly.
So you think I should do more PT around my hip and then we
Yeah, I
can
want your hip to be stronger. I don't want you to have that limp. I
circle
mean, I
back
think it's
to
because you've only just started walking, like in the last several weeks, that like consistently, right? Because you had pain, you weren't able to do it, and now I didn't let you walk for a long time. So that's why we're seeing this now. Now we can rehab that. And I think you should get a little bit stronger. And then when you're ready, we can take this thing out. I mean, it's healed. You technically don't need the rod anymore. We could take it out anytime at this point. Um, I'd like to see you get a little bit stronger first. But it's also a timing thing too. So if you feel strongly from a timing standpoint about getting this out sooner than later, we can do that.
well, that leads into another question that I just remembered when like thinking about the osseo and this
Mhm.
is that like because the timelines aren't going to match up at this point with Hollowworth saying that it takes however long to build the implant and then this and that, and that process hasn't been started yet, I don't think. So,
No, not yet.
um, because
Do you want to do a meeting with Holworth? Why don't you do a meeting with Holworth? Because he was a little nervous about how much pain you were in and if putting you through another surgery was a good idea or not. But you've come a long way, and I think that he may feel differently now.
well, that's what I was, I guess, thinking 2 months ago at that point when it came to the pain that I was having, the hardware getting removed, and an implant. I was thinking in my head in an ideal world it could all be done at the same time, but obviously that's not the case
So,
now at this point.
well, no, I mean, this hardware could come out at the same time you do an osseointegration.
But then
Like
it's
that
gonna
is
have to
possible.
come out way later because of the amount of time it takes to make the implant from going off what Dr. Holloway said.
Um,
Because he said it takes three
we
months from like start to finish.
That could be true, Stream. I don't know the answer to that, but I think the best thing is to do a virtual visit with him again and make a decision about the osseointegration and have him start ordering what he needs to order, and then we can coordinate the surgery.
Okay.
Okay.
Cause
That's your next step. That and changing the therapy to include the hip.
right. Cause if I'm gonna be like sore from the hardware removal anyways, might as well do the implant at the same time type of thing while I'm already not
That's
able
one
to
rehab. Yeah, I think
walk.
that's reasonable.
It just made sense in my head a few months ago when we did the screw removal, but
Yeah. So yeah, I'm on board. I think that makes sense. Take the metal, take the nail out at the same time you're doing osteo. I don't see why that's an issue. We have to confirm with him whether he agrees that's not a big deal. And then we'll do it together. It's fine. Cool.
um yeah.
You've come a long way, Daniel. You really have. I know you had a lot of bumps in the road, but you have a good attitude and you're getting on the right side of this thing. I see a lot of improvement here. I see a lot of hard work on your end. I see a lot of improvement, and I think that we're getting back on track to our original goals and original plan here.
Yeah, I would really like that cuz the biggest I guess one of the biggest fears of mine is not being able to even use my leg because of my overheating issue and like doing all
Right.
this for more mobility than being trapped in the same mobility issue that I once had with my overheating.
Listen, I think you raise excellent points. You make a good argument, and let's get Jason back involved and let's move forward. Okay.
Okay,
Awesome.
so
Great seeing you. Keep up the good work.
how do I get this new PT script and should I just
Bridget,
call?
Bridget's gonna send it to you, and
Yeah,
yeah, you can call Jason, his office, and I'll tell them right now to make an appointment for you to see him.
So could somebody
Dan, I'll
just.
email you the PT script.
Okay, thank you.
Yeah.
But I'll have the office reach out to you, honestly, because I'll just go talk to the manager right now and have them make an appointment with Jason.
Okay,
Okay.
great.
Awesome. All right, my man. Good seeing you.
Alright, talk to you soon.
Okay, hang in there.
Bye.
Bye.